My name is Sinkinson. I'm a physician working in Guatemala and in Santa Cruz, La Laguna, and Lake Atitlan. One of the things that we'd like to talk to you about today is Ascaris. Ascaris is a round word, and it's a helminth, and it's very difficult to diagnose for most people from the United States because we don't see it there. But it's something that we see a lot here, and the problem is that it's misdiagnosed a great deal. The symptoms of Ascaris mimic the symptoms of what we would consider to be reflux or gastritis in the United States. And in fact, most people who come from the United States who treat patients with the symptoms of Ascaris actually end up treating them incorrectly. They use proton pump inhibitors and other kinds of things that we usually use for gastritis or for reflux, but these things don't work because it's not the problem. What we see in patients who have Ascaris is a complex of symptoms. We usually see them present with mid-epigastric type pain, and this is what signals people to think that it is reflux or it's gastritis. But they also have another symptom complex that goes along with that. That includes a headache, sour taste in their mouth. They have increased noises or bowel sounds. They also feel that they sometimes have little balls in their abdomen from one place to another and they move. They also have hyperdefecation. Now, not diarrhea, but just hyperdefecation, meaning that they are defecating more frequently than normal, but they are not necessarily having loose stool or liquid stool. And the other thing that we see with them is anorexia, and we also see debility. The reason we see debility is because over time, Ascaris causes an iron deficiency anemia, and so they actually become anemic during the time that they have this particular infestation. What we use to treat this is we use a drug called albendazole. It's very simple to use. It's available in the United States. It's also widely available here, and millions of doses a day are used of this particular drug. A single 400 milligram dose for anyone who is over 3 years old, 200 milligram dose for anyone under 3 years old. And usually one dose takes care of Ascaris. It takes care of the larva, it takes care of the eggs, and it takes care of the adult worm. People usually show improvement within 24 to 48 hours, and they're free of it. The problem is that Ascaris is a recurring problem, and the reason it's a recurring problem is that it becomes patients acquire it through contact with fertilized eggs in the soil. The life cycle is that a person ingests a fertilized egg by having contact with the soil. Ingests that, goes down into the bowel, passes through the stomach, into the intestine, then it becomes a larva. That larva invades the wall of the intestine. The larva goes into the bloodstream and ends up being in the lungs. It matures more in the lungs and in fact can cause an eosinophilia, which is called Loeffler syndrome, which can actually cause a bronchitis. That's not a very common thing to see, but it is a possibility. After that, the larva goes into the trachea or into the bronchi, up through the trachea, crawls back down the esophagus, passes through the stomach again, and then becomes the adult worm. A female worm can lay somewhere in the neighborhood of 100,000 to 200,000 eggs per day. A male worm does not lay eggs. One of the problems in diagnosing this issue is that oftentimes we have false negatives. Some studies show up to 80 to 90% false negative results with this, even by using people who have used good stool concentration techniques and good microscopy. The problem is that when we have false negatives, we think that the patient doesn't have it, but they actually do have it. And so these patients need to be treated. So we can't really rely on a stool test to be able to diagnose Ascaris. What we have to rely on is the clinical symptomatology. When we know the clinical symptomatology, we see it. And it's amazing that a patient says, I have pain, and we as physicians or practitioners say, well, do you have headache? Do you have a sour taste? Do you have swelling of your stomach? And the patient says, yes, 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 and all of a sudden, we've got the diagnosis of Ascaris. Give them their single dose of albendazole, and they're good to go until they get exposed again. That's the problem. Because most of the people that we see live in the dirt and work in the dirt, they're exposed frequently to it, and so we have to treat them for this problem every time they present with the symptoms. what we realize is that patients sometimes have multiple problems. And one of the problems is Ascaris causing mid-epigastric type pain. The other problem is H. pylori. And so what we usually do is we treat them with albendazole first, get rid of the worm, and get that out of the picture. If the patient comes back to us and still has a problem with mid-epigastric type pain but doesn't have the rest of the symptom complex, we assume that they probably have H. pylori. For those patients, we treat them with azithromycin, 500 milligrams a day for 5 days. Secnidazole, which is a drug that's not available in the United States but is a relative of metronidazole, and we give 2 grams of that as a single dose. And then we use a PPI, such as omeprazole, lansoprazole, pantoprazole, for 15 days. And usually this takes care of the problem of the H. pylori. If they continue to have problems after that, we assume that they have reflux, and we go ahead and continue them on the PPI for a prolonged period of time to be able to take care of those symptoms.